Welcome to COVID Conversations, where we discuss the latest COVID-19 news with the experts. Declining COVID-19 cases has Massachusetts officials looking to get students back to in-person learning. Emerging data suggests that young children in schools have not been major contributors to the spread of COVID-19. A recent study led by researchers at Beth Deaconess Medical Center suggests that the optimal physical distance between students wearing masks in a school setting could be 3 feet rather than 6 feet. So what differences could this make for children in schools? And would it have an impact on older individuals and physical distancing as the number of vaccinated adults continues to grow? Westyn Branch-Elliman is an infectious disease specialist at Beth Deaconess Medical Center and a corresponding author in this recent study led by BIDMC. She joins me now. Dr. Branch-Elliman, welcome.
Thank you so much for having me. I'm really thrilled to be able to talk about our research and what the implications are for bringing kids back to the classroom. And I think parents across the Commonwealth know that this issue has been a critically important one. 3 feet versus 6 feet, it seems like a very, very small question, but it turns out to be critical because at 6 feet, only about half the kids can return to the classroom. So it was very critical to know if we actually needed 6 feet or 3 feet would be sufficient for keeping kids and staff safe. So what we did was we collected infection control plans from across the state of Massachusetts and combined that with data about cases among students and staff participating in in-person learning reported to the Department of Elementary and Secondary Education, and also combined that with data from the DPH about case rates of COVID-19 in the community. And we found no substantial difference in cases among both students and staff participating in in-person learning among districts with 3 feet versus 6 feet. And so this is a really, really important finding because it means a lot more kids can return to the classroom. Parents and teachers and students should all feel very reassured that 3 feet is safe. And that's great news because it means that we can get them back into school. And we know that keeping schools closed has a lot of negative consequences. We've seen increasing mental health visits. In some states, they've reported increasing suicides in adolescents. We're seeing concerns about rising rates of childhood obesity and learning loss and increasing disparities. And so it's critically important that we find a way to bring our kids back to school safely. And so that's why this research was so important, because it should bring a lot of kids back to the classroom.
One of the key things I think that the study mentioned was that the 3 feet versus 6 feet, but wearing a mask is still a crucial part of identifying that difference, yes?
Absolutely, and that was one of the important things that the state of Massachusetts added. So here in the state of Massachusetts, we have a near universal masking mandate for students and staff. During most of the study period, there was a universal masking mandate for kids in grades 2 and up and for all adults. And masks were strongly encouraged in the younger grades, if not required in the younger grades. We've since moved to universal masking for all kids because we have now seen that kids of all ages can wear masks. Up front, there were some concerns about kids and compliance and their willingness to wear masks. But the good news is we know from other studies, we didn't measure masking it specifically, we measured the policy. We know from other studies that kids can do a really great job wearing masks. And so our study does need to be considered in the context of universal masking. We certainly would not recommend going down from 6 feet to 3 feet without the masking policy. That's a critical cornerstone of the infection prevention as it relates to COVID-19.
What are some key points that people should keep in mind as they learn more about this, as they read the study, as they make their decisions, with their children?
So I think the key question is, what happens in schools and can we open schools safely? And if we can open them safely, then how can we open them safely? And this study really gets to the how. Can we open schools safely at 3 feet? And our study says, yes, 3 feet is just as safe as 6 feet, and that schools have lower cases than in the community, and so schools are safe.
It's an amazing study, and it's really eye-opening, and hopefully will lead to more information to make people feel comfortable with their children in school.
We really hope so, and I just want to emphasize that our study is the first to directly compare 3 versus 6 feet. But there's a worldwide body of evidence that supports this finding. And honestly, we weren't surprised that we didn't find a difference between 3 to 6 feet. Based on what we've seen from what's happened around the world, the key is that this allowed us to directly compare the two distances and found no difference.
That's great to know. Great information. Dr. Branch-Elliman, thank you so much for taking the time to speak with me. I really appreciate it.
Thank you so much for having me. I'm happy to come back anytime. It was great talking with you.
Good. Well, congratulations. You've got yourself a free invitation right back.
Sounds great.
Thank you so much. This is
Bye.
COVID Conversations, where we discuss the latest COVID-19 news with the experts.